have been a lot of things about hydroxychloroquine, this drug, whether it, inhibits the course of this viral infection and potentially improves the outcome. So, initially it has been just a thing that it may be effective, but now, it's in for many trials. Many positive patients are being given this medicine, and initial reports look that it's promising in terms of that the COVID infection, if that is spanning for 15 to 20 days, that's the period where the body immunity actually, kills the virus. So the persons where the hydroxychloroquine has been given, the patients have shown a better response, and they have become negative of the virus in about 5 to 7 days. So that is where it is being thought that this drug is acting perhaps, and where we don't have a concrete treatment as for now. There's no vaccine, nothing specifically against this virus. So this may be acting. So it's not a real tricky scenario that we can think of utilizing the drug until unless we don't have any concrete treatment plan. I think we can have inputs from Dr. Mittal and Dr. Talwar also.
So, word of caution, every drug is a poison. And that is one thing when you have to draw a Lakshman Rekha around yourself, when to take and when not to take. Otherwise, if every Tom, Dick and Harry starts taking hydroxychloroquine, there would be more people landing up with problems than coronavirus infections. The other thing is that hydroxychloroquine, the mechanism of action also is not very clear. They say that possibly what it does is, just like Dr. Kapoor said, that elimination of virus happens faster. But the only thing which is being known is that incidence of deaths, incidence of requirement of ventilation, and incidence of viral clearance is much faster in this population. So that is something which is doable. And as recommended, people who are much more notoriously vulnerable, they can also be put on a preventive dose. Notoriously preventable means anesthetists, those who are doing ventilations, those are handling corona cases in the hospitals and all. But it should not be, and also the people and the first degree relatives of people who are infected, and they have come into contact. So that kind of thing can be done. But I don't think that everybody should take it, because there are risks of increased QT syndrome, which can lead the person to sudden cardiac death also, besides the gastritis and ulcers and all nausea, vomitings and other things, and visual problems. A lot of other things can go wrong. So it's not good to take a drug just on the presumption that it would help. Only those who are most notoriously vulnerable should actually be put on the drug rather than otherwise. Dr. Talwar?
Yes, sir. I totally agree with you. Not everybody should take it. Only the contacts of the patient and paramedicals who are working in ICUs and who are working in places where there are more patients. Only those persons should take it. And the older persons should get an ECG before starting the HCQS. And if azithromycin is added, all the more reason to get the ECG done before taking these drugs, especially in old age or cardiac patients.